This video is for general information only and is not a substitute for medical advice. Always speak to your GP or diabetes team for guidance tailored to you. Are you living with type 2 diabetes and feeling exhausted no matter how much you rest? You're not imagining it, and you're definitely not alone. Fatigue is one of the most common symptoms of type 2 diabetes, and it's far more than just feeling a bit tired. This is a deep, persistent exhaustion that doesn't lift after a good night's sleep, and it can affect your work, your relationships, and your day-to-day life in a really significant way. So why does type 2 diabetes make you feel so drained? At the heart of it, diabetes affects how your body processes glucose, the primary fuel your cells rely on. With insulin resistance, your cells struggle to access the energy they need, even when there's plenty of glucose circulating in your bloodstream. Glucose is there, but your cells can't use it effectively. Your body ends up essentially running on empty. But it works in the other direction too. If your blood sugar drops too low, something called hypoglycemia, your brain and muscles are suddenly deprived of energy, leaving you feeling weak, foggy, and completely wiped out. Low blood sugar is more likely if you use insulin or certain tablets such as sulfonylureas. So if you're experiencing those symptoms, do discuss them with your diabetes team. And there are often several other contributing factors happening at the same time. Anemia is more common in people with diabetes, linked to kidney disease, iron deficiency, or low vitamin B12, which research suggests may be associated with long-term metformin use. If your body isn't producing enough healthy red blood cells, less oxygen reaches your tissues and tiredness follows. Sleep disruption is another major piece of the puzzle. Obstructive sleep apnea is more prevalent in people with type 2 diabetes, and even without it, needing to urinate frequently during the night can seriously fragment your sleep. Poor sleep quality feeds directly into daytime exhaustion, and it can make blood sugar harder to manage too, so the two issues reinforce each other. Thyroid problems can also occur alongside diabetes and may contribute to fatigue. It's worth discussing testing with your GP if you're struggling with persistent tiredness. And it's worth acknowledging the emotional weight too. Managing a long-term condition is genuinely tiring in itself. Research links diabetes-related fatigue to reduced physical activity, poorer self-management, and an increased risk of depression. So if you're struggling emotionally as well as physically, please do speak to your doctor about that. So what can you actually do? The most important conversation to have is with your healthcare professional about your blood glucose control. Keeping levels as stable as possible is one of the most meaningful steps you can take, but only your prescriber or pharmacist should make any changes to your medicines or doses. It's also worth asking your doctor to check for underlying conditions. A blood test can identify anemia, B12 deficiency, thyroid issues, or kidney concerns, all of which are treatable once identified. Regular physical activity, though it might feel counterintuitive when you're exhausted, is supported by evidence as a way to improve energy levels over time. Even gentle, consistent movement can make a difference. And if you suspect sleep apnea, particularly if you snore, wake unrefreshed, or your partner has noticed you stopping breathing, raise this with your GP. It's very treatable. When should you seek help more urgently? Speak to your GP if fatigue persists despite reasonable blood glucose control, if it's getting progressively worse, or if it's accompanied by other symptoms. And seek prompt attention or call 999 if tiredness comes alongside chest pain, severe breathlessness, or confusion. Don't dismiss fatigue as something you just have to put up with. It's a legitimate symptom and it deserves proper attention. To recap, type 2 diabetes-related fatigue is real, it's common, and it has multiple causes. The good news is that many of these are addressable, and with the right support, many people do see meaningful improvements in their energy levels. If this video was helpful, please give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health information. Drop any questions in the comments. We'd love to hear from you.